ICU environment is ever so dynamic and changing. So we really need to make sure that we have someone who can just go with the flow. So I would say take a deep breath. It's going to be okay. We are just trying to get to know each other during the interview to see if it's going to be a best fit for us, as well as just as much as it's going to be a best fit for you. Take your time in answering the questions. If you need to take a moment, that's fine. And just be open, honest, and transparent.
We know that these are new grad nurses coming in. They're not going to have all of that foundational nursing that some of the experienced nurses have. So we start from scratch. And so the skills that we really like to see and really pull out of them is that resiliency, because what's happening in the ICU, you need to have that skill. You need to be able to bounce back from difficult situations. There's a lot of things that happen in the ICU that are very difficult to handle.
Research assistants, although you're not in the clinical environment, have proven to be very successful in an easy transition into the ICU environment. But again, I think it really is about just taking your past history of employment and being able to kind of, again, use examples to help answer the questions when it does relate to customer service, stress management, multitasking. So I can't think of any one particular job where I was like, whoa. I think most ICU managers see the resume as a whole and not just one single thing that would say, hey, no, I'm not going to consider hiring you for the position. Here at University of Maryland Medical Center, we do take care of the sickest of the sickest, not only in the state and the nation. The ICU environment can pose as a very stressful environment. So you want to be able to manage your stress in the best way possible. So I always, even during the interview process, ask about stressful management and really taking that kind of self-reflective approach. It goes back to the fight, flight, or freeze. No matter which one you are, you just have to know how to get through those situations because it is a dynamic environment. Patients are critically ill. So I think that's a big part of knowing what you're getting into when you're going in the intensive care unit. I highly recommend getting into a healthcare environment prior to applying to an ICU, just so you are kind of a little bit more familiar with the flow, with patients, interacting with patients, just having kind of like really that situational awareness, and that experience really is important, I believe, when interviewing for an ICU position.
If they are really interested in a specific area in nursing and they've gone out of their way to work in that area as a student, to volunteer in that area, to join an organization, those are really impressive. Those are very impressive.
I think the way that we can really kind of have a successful interview is to be able to really speak to and talk to one another, and I may ask you to elaborate. So if I do feel like it's kind of those typical answers that anyone would expect, that's why I would really take in consideration of thinking about specific examples from your past. It could be even from school. It can be any time during your work experience, but come with examples because we may build off of that throughout the interview process.
I like that they are, well-groomed, and I like that they smile. I like that they are prepared, and I don't like a candidate that is late for the interview or when they are coming dressed up like not professional.
Other things that would impress me is someone who might bring a notebook, be taking notes during the interview, have some questions prepared for the hiring manager that they want to know about the organization. One thing that would impress me is if a new graduate asked if this organization had magnet status and how many times they had been recognized as a magnet organization. Those things would impress me. Hiring managers are looking for someone who can think critically through the interview process by answering questions that may throw you off a little bit.
I realize that interviews can be very stressful and anxiety-provoking, but try to be as comfortable as possible.
I think what impresses me the most is new grads, even new hires that are proactive. They're proactive about learning. They're willing to ask questions.
Hiring managers look for somebody who's very passionate about the job, especially in a nursing career. Somebody that's very compassionate. Somebody who's also eager to learn. We know that this is very gratifying job and you're gonna encounter a lot of challenges along the way, but somebody would really stand out if is very open-minded and eager to learn, and on top of that is very compassionate about nursing.
Thanks for watching. To get full access to our Simple Nursing New Grad Prep course filled with tons of helpful tips and tricks, simply click the link in our description below. Remember, don't be scared, be prepared. Ensure a smooth transition into your nursing career with our new course. See you guys there.